As Nigeria and other West African countries continue to grapple with the devastating impact of malnutrition in hospitals and communities, stakeholders are calling the federal government to establish a multi-sectoral national task force dedicated to addressing hospital malnutrition through coordinated policy, sustained funding, and effective implementation. Speaking virtually at a press conference, the founder and president of the West African Society of Parenteral and Enteral Nutrition, WASPEN, Dr. Teresa Isichei Pounds, described malnutrition as a persistent crisis that disproportionately affects vulnerable populations, one that must be tackled through integrated hospital and community-level action. She emphasized that the upcoming 2025 Clinical Nutrition Conference, scheduled for June 17 to 19 in Abuja, will serve as a critical platform for addressing these challenges through professional training, policy advocacy, and research.
WASPEN is also pushing the fact that we need the team approach to provide the best nutrition support to these patients. We need the dietitians, the nurses, the pharmacists, and of course, the physician has to lead that effort. So I think what they can do is to have a task force made up of these representatives. WASPEN, of course, is willing to work with that task force. Then we need to do what we call an assessment, a needs assessment, once this task force is sanctioned. I think that's where we're going to recognize some of the gaps and opportunities we have in in terms of malnutrition in the hospitalized patients. And from finding the gaps, then we can start coming up with the solutions, to address it. I think we've done a great job when you look at the information we're presenting or showcasing about malnutrition in the community. It's time for us to do the same in the hospital. We have great opportunities in the hospital. We have a skeleton in the closet in the hospital that is actually called malnutrition. It's time for us to continue to put our hands together under the leadership of the federal government to really see what can we do. And WASPEN is willing to partner with this group.
In his remarks, Professor Mohammed Raji Mahmood, Chief Medical Director of the National Hospital, Abuja, and official host of the conference, reaffirmed the hospital's commitment to combating inpatient malnutrition through early screening, improved clinical nutrition support, and a multidisciplinary approach to care.
Countries. We are actively building the vision of bringing together all the disciplines involved in providing nutrition, specialized nutrition support to our patients, the dietitians, the doctors, nurses, pharmacists, allied professionals into a unified interdisciplinary association. So what is our focus? Our focus is early identification of patients' nutritional status once they are admitted into the hospital. This leads us to timely intervention in both the hospital and community setting.
We have some patients that come in that undergo major surgery, and after that they have problem of being able to take orally. So we have provision for parenteral nutrition for them. So once we have patients like that in the ward, these committees, this steering committee usually work in conjunction with dietetics and the managing team, the managing physician, whether it's a physician or a surgeon, to optimize the patient so that the outcome of the surgery will be better. But with this incoming WASPEN conference and with the collaboration we have with the WASPEN itself, we intend to improve what we have on ground to ultimately improve the management of patients with malnutrition.
With the conference theme, Bridging the Gap, Integrating Hospital and Community Malnutrition Care in Developing Countries, stakeholders said the event speaks to a pressing reality. Lives continue to be lost due to fragmented nutrition care systems that fail to sustain treatment beyond hospital walls.